in the trends coming into COVID, things were looking better. Cases, incidence was coming down slightly, PrEP use was inching upwards. We've leveraged some opportunities and some learning here through the COVID pandemic. And then I think we've also had some real challenges. We don't yet know and have all the data that we're going to need for this last year's period of time to see where things will fall out. But I share the concerns that PrEP use likely fell. Sexual activity may or may not have fallen. Have they become more isolated and stopped taking their meds and things that we really worry about? And that's where I hope some of the interventions like self-testing and telemedicine that have scaled up a little bit will counterbalance all of these things that I think I and others are very worried about. One of the things that we are really excited about in the $7.4 billion put forth in public health workforce is that we will have a workforce that is upskilled and many different areas, that will have community health workers that are from the community and that might be able to do outreach, not just in COVID, but in all areas of health, including HIV. This epidemic now is in the South, it's in certain demographics, it's in places and people who are getting less access to care. We have really great PrEP uptake and use in the Northeast and the Northwest, but not as much in the South. So why is that? Is that cost of drug? Is that access? Is that Medicaid expansion? There are a lot of things that are not just about the money, but about the policies that make that difficult. We've spent a lot of time this past year or this past several months talking about how are we going to reach communities for COVID-19 vaccine. And I would say the same lessons that we will learn in COVID-19 and perhaps have learned in HIV, we need to double down and do in both. In the big picture, what we know is we currently have the tools that we need to control this pandemic. We know that antiretroviral therapy not only works to suppress virus in the individual, it works to suppress virus and to decrease transmission to others. We know that for those who can access PrEP and stay on it regularly, that works to decrease acquisition. We have all of these tools, and now really it's a matter of political will, deployment, and getting it to the people who need it.